Good morning. My name is Chika Nwanedo and I will be discussing health information exchange. Health information exchange is the electronic sharing of clinical information across the boundaries of healthcare organizations. It's also used to improve efficiency, cost effectiveness, quality, and safety of healthcare delivery, according to Hirsch et al. Most patients, with chronic illness have more than one diagnosis and they have more than one provider. Health information exchange allows the patient's medical record to follow them electronically to their different providers in real time. By 2014, 76% of U.S. hospitals had engaged in some form of health information exchange. So health information exchange gives doctors, nurses, other healthcare providers, and patients a chance to access and securely share a patient's vital medical information electronically through an integrated system of network across the continuum of care. What are the types of health information exchange? We have the direct exchange that gives healthcare provider the opportunity or the ability to electronically send and receive information like summaries, discharge, patient referrals, lab works and results. We have the query base that is used in emergency or unplanned visits when the patient can query and get patient's information, request information on the patient and get it, and then the consumer mediated that the patient controls over the internet. Why do we need health information exchange? This is really a good thing. Health information exchange is a good thing. It reduces medical and medication area, thereby improving healthcare quality and safety of the patient and patient outcome in general. It bridges the gap in continuity of care, in coordination, in follow-up. All those things that fall through the crack, it bridges that gap. It also improves public image, public health reporting and ambulatory care, quality care, disability claims and processing. All that is enhanced through health information exchange. There's also the cost part of it. Healthcare information exchange or health information exchange help lower costs in the U.S. by removing duplication of services like the radiologic test or lab test or whatever that is duplicated because this doctor doesn't know that this one has ordered it. All that is removed, but because it's there in the health information exchange. So regarding federal laws that guide health information exchange, we have the HIPAA, we have the HITECH, MACRA, meaningful use regulations, and the HIT. HIPAA was enacted in 1996, and with the health information exchange and electronic sharing of information, it became imperative for the federal government to standardize a federal legislation that supersedes state laws that will protect patient information. It will protect the patient's privacy, and that's what it does, regardless of where the patient lives or where the patient received health care. This went into effect in 2003. HIPAA has the privacy provision is regulated by the USDHHS, the Department of Health and Human Services, and was standardized in August of 1998. The concepts like protected health information, ethical issues was in the discussion, came up, and November 1999, the proposed rules for health information privacy was released by USDHHS in order to balance patients' rights of privacy and the provider's need to access information. And this was in April 2003. The privacy requirement went into effect, and in April of 2005, the compliance with all the entities, the compliance was demanded of all entities to comply with the privacy section or with the HIPAA section, the HIPAA. Health information technology and economic clinical health. That's Title 8 American Recovery and under the Title 8 American Recovery and Reinvestment Act of 2009. It was signed into law on February 17, 2009. It had the adoption and meaningful use of health information technology. The high-tech provided HIPAA more protection. So with the high-tech health information exchange, HIPAA improvement was seen in the healthcare system in the US. It improved safety and efficiency and quality care of patients. It increased coordination of care among providers. It improved health status of the US population as a whole, and also helped the patient get engaged in their care. I just want to talk about the meaningful use regulation. It provides financial incentive to all establishments and entities that use electronic health record technology to improve care quality, safety, and efficiency. So with this, it reduces health disparity. It went into effect April 30, 2010. So the MACRA provides for reimbursement of services based on quality care. The state laws regarding health information exchange. In 2017, the Appropriation Act was enacted by the House, the Senate House, and the House of Representatives in North Carolina, and it modernized the HIE, the Health Information Exchange. With the modernization, it's expected it will accomplish greater outcome for patients, create efficiency in the state-funded programs of Medicaid by making providers connect to the Health Information Exchange of North Carolina, which is the North Carolina Health Connects. And they did need to do this by June 2018. That's the deadline. And other providers will need to connect by June 2019. State legislation, the opt-in is in, the opt-out was repealed by the North Carolina legislation. Barriers of health information, ethical issues, confidentiality issues, privacy, security breach is a barrier for the enhancement of health information exchange. Inconsistency in policies and laws. Too much information. Some providers feel they have too much information and they may miss something and get sued. Cost of health information exchange is high even for small providers. They even to train their staff members, and the disruption of workflow is all seen as cost for them. The impact of social stigmatization of certain illness. People that get stigmatized do not want their information out there. So that's like a barrier. Ethical dilemmas and lack of consumer education. A lot of people feel like patients that are in the health information exchange do not really understand it. So for recommendation, I recommend that financial incentive and educational program be given to the private sector to get them to register in the North Carolina Health Connects. So the consumers and private sector can get engaged. They can be trained with the educational program and financial incentive to get them engaged in, and also get them connected in the technology, in the HIE. The other thing is that for the opt-out, North Carolina awards recommend that the opt-out be put back. They don't need to repeal it, because for people that are stigmatized, they can still have the option to release their information, and the doctor will still have access to it in case of emergency than when it's repealed completely and taken out. And the rest is my references. Thank you for listening. Thank you for watching.